WHO ने अब नोवेल कोरोना वायरस आउटब्रेक को पैंडेमिक डिक्लेयर कर दिया है।
That COVID-19 can be characterized as a pandemic.
मगर उससे पहले इसको इन्फोडेमिक डिक्लेयर कर दिया था क्योंकि बहुत सारी मिस इन्फॉर्मेशन और फेक मैसेजेस फ्लोट हो रहे हैं सोशल मीडिया पर। Actually, misinformation is spreading faster than the virus itself. So much so that even our ministers are endorsing the magical powers of cow dung and cow urine to get cured from coronavirus. To get an idea of how weird the scene is, just look at one of the WhatsApp forwards like this one, which claims that an old Chinese doctor has actually found the cure for coronavirus, and it's actually just a bowl of garlic. Obviously, WHO ने बोल दिया है that there is no scientific evidence to this study. Another message claims that consumption of vitamin C can actually kill the virus even if you're infected with it. There are scientists in China who are trying to understand the link of vitamin C with coronavirus, but there's actually no study yet to prove the same. And it's probably because of messages like these that people in India and around the world have resorted to panic buying of masks and sanitizers. हमें लग रहा है कि अगर हम मास्क और सैनिटाइजर्स यूज करेंगे तो हम सेफ रहेंगे, मगर ऐसा है नहीं. Doctors say that COVID-19 isn't transmitted through air unless someone sneezes or coughs in your face. They spread via surfaces, so there's actually no point buying masks at 5 times the price. और वैसे भी एक मास्क को ना हर 2 घंटे में बदलना होता है. So now you can imagine how much you'll end up spending in replacing all the masks. Similarly, जो हमारे regular sanitizers होते हैं ना, they're not actually very good at killing viruses unless they have 60% or more alcohol in them. So keeping yourself clean isn't a bad thing at all, but just don't go overboard with it. I think social media and fake news have somehow become synonymous with each other. और ये ऐसा इसीलिए है because research suggests that हम लोग उसी मैसेज को फॉरवर्ड या शेयर करते हैं जो या तो हमें जेन्युइन लगता है या फिर हमारे सर्कल ऑफ फ्रेंड्स या रिलेटिव्स से आता है. इसी वजह से हम लोग उसे फैक्ट चेक नहीं करते, and that's how we keep on contributing to this endless cycle of fake news. Yes, social media platforms like Facebook, Twitter, YouTube and others are trying to fight this infodemic by directing the users to credible websites like the WHO or our health ministry's website. But itni sari misinformation hai na that these companies are facing an uphill task in controlling it because they are fighting the very algorithm which is built to prioritize speed and engagement. Even the government has issued public health advisory on various social media platforms to contain the spread of misinformation around coronavirus. पता है COVID-19 का mortality rate अभी 3.4% के अराउंड है और ये इसीलिए ज़्यादा है क्योंकि वुहान जो एपिसेंटर है इस आउटब्रेक का वहाँ सबसे ज़्यादा डेथ्स हुई हैं. It's 5.8% in Wuhan right now and 0.7% in the rest of China. Now, if you compare this with the mortality rate of SARS, which was 10%, and MERS, which was 34%, the world wasn't panicking the way we are panicking right now. Maybe it's because of the fact that social media either was not there or its reach was not as extensive as it is right now. अभी तक not even a single child up to the age of 9 has died from COVID-19. The mortality rate is very low for people below 60. It's only for the elderly people and even among them those with a respiratory condition that the mortality rate is a cause of worry. So let's be sensible and take necessary precautions rather than just panic. One more thing, the 2003 SARS epidemic had spread to 29 countries across the world and had killed nearly 1,000 people. But only 3 Indians were infected by it and recovered very quickly. MERS didn't even reach India, even though people traffic between India and West Asia is very high. And all of the 327 people who were evacuated from Wuhan when the mortality rate was at its peak were free of any infection. I understand that with more than 73 cases of coronavirus in India and more than 118,000 cases worldwide, coupled with 4,300 deaths, the scare is quite legit. And the numbers are surely going to rise. But what can we do? We can wash our hands frequently, cover our mouths and noses while sneezing, maintaining a 1 meter distance from someone who's coughing, and of course keeping ourselves updated with news from credible sources might just be more helpful than forwarding fake messages on social media. Yes, I'm thinking aloud. What do you think? Tell me in the comments below. And if you like this video, then share it and subscribe to India Times.